I am reliably informed by very, very good sources that the virus COVID-19 we are facing now is of category AB, meaning soon it will hit AA, and at that stage, just like it is today, AB, victims succumb within 48 hours. There is no treatment, there is no non-treatment, and it is also airborne. I want to be specific to Ministry of Health Kenya that instead of giving us figures and numbers of people who are suffering, tell us what you are doing to prevent this menace. I have a serious issue with you on Nakada. Nakada is a parastatal, like it used to be called, but or SAGA as you call it today, but it's a government agency. You have spent billions and billions of shillings trying to do what you are doing. Fine, it's good you are doing it. But the people who are in contact with the people who suffer, the addicts, is Nakada. The estimate as of today of people suffering, people who are already clinical addicts, is 8.6 million. You don't have contra figures. This is research carried out by universities and Nakada. 8.6 million Kenyans require treatment urgently because they are clinical addicts. In contrary, your Mathare Hospital, shame. Mathare Hospital has a bed capacity of 60. 60. That is the bed capacity of Mathare Rehabilitation. You also have Gilgil between 5 and 12. And of course, General Hospital, which is not yours, of between 5 and 12 again. At a capacity of less than 100 patients, then you are the problem. You are not recognizing other professionals. It is even more weird. It is sinful. It is, I don't know how to put it. When you look at your NHIF and how they look at the people who deal with addiction. We have treated patients here, including 300 police officers, all of them fully accredited with NHIF, and for 3 years they have not been paid. We have not had any reimbursement for 3 years, just because they're addicts. Shame on you. NHIF, pack and go. Just go home. Your godfathers at Ministry of Health. They don't recognize addiction as a disease. The former minister, when he came to State House to come and explain the status of health in the country, did not even mention one word on addiction. Mututho Kagwe just came now, the other day, and he has very quickly learned bad manners in terms of recognizing what is ailing Kenya. What do you do with 8.6 million people who must take those substances daily, particularly alcohol? How are you going to control them? By way of a gazette notice that you are planning to do? How are you going to do it? And if you come and have total withdrawal tonight for everyone, are you aware some of them will end up dying? Because of the complexities that you may not understand for now. I believe and trust those guys at Afya House in charge of mental health need treatment themselves. And they better come to Jomek where I learn and treat them. There's something very sick about that ministry. And the way you treat other agencies and the way you reflect and work on people with mental conditions. Addiction is treatable, but must be treated scientifically. There are protocols, and for now, you have just ignored it. We have COVID-19 now with us here. There is going to be a very big mess because of these people struggling to come and get the substances. You should consult Nakada. You may hate them. You may deny them money. Their total annual budget is a paltry 300 million. 300 million to pay for salaries, to do the whatever they have to do. 300 million. And you are thinking in billions. Yet you cannot identify the source. These people, the truck drivers flying through here, and the Amira and all that, all those truck drivers the way the mess they're living to towns, and they end up with in those drinking joints and the rest of it. And you people, Nairobi people, what were Nairobi? When you come to the rural area and your drinking habits, whatever mess is coming through is because of addicts. Call them alcohol addicts, call them drug addicts, call them sex addicts, call them anything you want to call, but refer to NACADA so that they can give you a guideline. And if there's a national budget, it's not private business by Minister of Health. National budget is national budget, and they must get a share. I estimate right now, NACADA requires urgently not less than 12 billion shillings so that they can use at least 3 billion on campaigns, because I've done a very good job in the past on campaigns, and have 9 billion on practical approach towards treatment of these people who are addicts. And the practical approach is this. NACADA, listen to me. I was your boss. I know you. I know you are competent. I know I've seen your certificates. We interviewed you. I know you are qualified. You are good to go. Go, when you have the money, don't construct a rehab. Go and have assigned wards in each of the level 5 hospitals or level 4 hospitals. Do your detox there. Send a competent team of psychotherapy. Do nutrition. Do everything that has to be done. Use modern medicine like naproxen. So treat these people. But don't just reason to people who are in Afya House, particularly those ones in the mental health department. And I repeat, they require treatment down at Afya House.